Hi, I'm Shawn Hannan with Tampa Bay Furnishings. I'm also this year's chairman for the Real Men Wear Pink campaign for Pinellas County, where we are raising funds and awareness to fight breast cancer. This morning, I'm here with Dr. Melinda Roskos with Roskos Cardiology here in St. Petersburg, Florida, and welcome to the Awareness Lounge.
Well, thank you. Thank you for having me.
So why is a cardiologist interested in breast cancer?
I'm interested in breast cancer because I'm very interested in a new field called cardio-oncology. And it's a crossroads between cardiology and oncology. So a lot of the recommendations I make for my heart patients, exercise, maintain a healthy weight, stop smoking, are the same things that you'd encourage people to do to avoid cancer. In addition, as people have done, as we've done better at curing cancers and people are going on to live longer, we're realizing that a lot of these breast cancer survivors go on to develop and sometimes even die from heart disease related to their treatment. And so I really believe strongly in increasing our awareness of this association so that not only do doctors know, but patients and their families are also aware.
Yeah, and so you mentioned treatment. What is it about breast cancer treatment that could actually be bad for your heart?
So breast cancer is very unique in that there's a lot of the treatment modalities can actually impact your heart. So for example, chemotherapies with doxorubicin or immunotherapies with Herceptin can go on to hurt the heart muscle and lead to something called a cardiomyopathy that can result in heart failure. There's other kinds of immunotherapies that can lead to high blood pressure and high blood pressure can cause things like heart attacks, strokes, and kidney problems. And finally, the radiation that often gets used can affect the heart muscle, the heart, and the heart valves. So you can see a lot of the modalities that are going to be used to treat breast cancer are also potentially hurt the heart.
Yeah, and this is really interesting because I actually talked to someone, a breast cancer survivor, a couple weeks ago, who mentioned they had a family history of heart disease, which impacted the breast cancer treatment they could use.
Yes. So that's an excellent point. So when you are first diagnosed with breast cancer, part of that initial evaluation really needs to be a thorough assessment or investigation into what your risk factors are for heart disease. So if you have things like high blood pressure, high cholesterol, or have a history of heart attacks or heart failure, you really need to optimize those before you start treatment. Because like you said, your treatment and your overall breast cancer prognosis can be impacted by how healthy your heart is.
Okay, and so what would be the right time? I just got diagnosed with breast cancer. What's the right time to contact a cardiologist?
So I like to get involved as soon as you've been diagnosed with breast cancer. There's labs that we might want to do just to establish a baseline. And also, really importantly, is that you want to look at the pumping function or the ejection fraction of your heart before you start therapy, treatment for your breast cancer. And so you want a cardiologist that's going to read the same type of study over and over again, because any type of significant change in that ejection fraction can affect the type of chemotherapy and treatment you get.
Okay, so my breast cancer is now in remission, right? I'm fine. What should my long-term follow-up be?
So your long-term follow-up will be a bit individualized, just based on the type of cancer you had, the type of treatment you had, and what your risk factors are. So definitely talk to your oncologist once you hit remission and make that long-term plan. But in general, if you had any type of radiation, you are going to need periodic echocardiograms or ultrasounds of your heart throughout your life. So we might start 10 years after treatment and then every 5 years. If you needed medications because you developed heart failure, that's something that you might be on forever. Or if you stop those medications, it's a long conversation that you have with your doctors.
Yeah, and I know you and I had a really good conversation, and something you're passionate about is really making sure that you provide your healthcare provider, your doctor, with information from your past. And you want to talk a little bit about that because it's just so important.
Yes. So I met a patient. I was taking the history, getting to know him very well, and he told me he really had no significant past history. And so I went through just a variety of questions and asked if you've never had cancer. And he mentioned, oh yeah, I had cancer when I was 15 and leukemia. I went through all the treatments and radiation and I went into remission. I've been fine since. I didn't even think that was important. Well, actually it really is, because he mentioned the radiation. So, he could have increased risk of having heart valve problems, and that could develop earlier in life. And so please let all your healthcare professionals know that you have any type of cancer history, even if you're in remission and it's many, many years ago.
Yeah, so very important. Make sure you let your healthcare provider know your history. Just because you had it when you're young doesn't mean it didn't exist, and it certainly can be impactful critical to your health in the future.
Thank you.
So, Dr. Roskos, thank you so much for joining us in the Awareness Lounge. And now, how can folks get in touch with you and your practice?
Oh, please, check out my website. It's roskoscardiology.com.
Okay, and how do you spell that? Just so we know.
Roskos, and then cardiology.
Awesome. Well, thank you, Dr. Roskos. We know this information is just absolutely critical for awareness and prevention, and thanks for joining us.
Thank you.